Some of you, I'm sure, are wondering, well, what about my gut? What about the biome? I know this is very trendy. It's all over the place. And I agree it's hugely important. That would be another talk in and of itself, and to touch on it briefly in terms of musculoskeletal for you. Your nutrition generally decreases, meaning the quality of your nutrition as you age. I'm not sure why. I think because in modern society, particularly in this country, our elderly are not taken care of as well as they probably should be. And so a lot of them aren't getting the good home-cooked meals they should be getting. And then you get decreased levels of immune-tolerant bacteria in your gut and increased levels of opportunistic bacteria, or bad bacteria, okay? If you're not feeding the gut, if you're not giving it good fiber and good nutrition to make the gut biome where it should be and producing the proteins that are necessary for human life, just remember this, we're not really humans carrying bacteria, it's more that we're bacteria carrying a human. So I think there's something like 37 billion cells in the human body. You have 100 trillion, maybe it's 37 trillion. You have a lot more bacteria hanging out in your gut. So there's more bacterial cells in you than human cells. And they're biologically active, and they need to be fed the right stuff to make the right proteins to help you out. Worse, if you get damaged lining in your gut, which is connective tissue, so there's these things between the cells called the tight junctions. If the tight junctions in your gut lining split apart and get loose, they're gonna let toxins and bacteria, and that's the so-called leaky gut you've probably heard about from a bad gut biome. And this is when you get endotoxins like introduced, essentially poison introduced into your bloodstream directly from the gut. And this in and of itself can cause arthritis and musculoskeletal problems.